InflammaDry is the first and only rapid in-office dry eye test that identifies elevated matrix metalloproteinase 9. Using 4 simple steps, InflammaDry test results are achieved in as little as 10 minutes, aiding in dry eye diagnosis and allowing a treatment plan to be established with the patient during their office visit. The InflammaDry test includes 1 foil pouch containing a sterile sample collector, 1 foil pouch containing a test cassette, and 1 buffer vial. Tear open each foil pouch at the indicated perforation and remove the contents. Do not touch the sterile sampling fleece prior to collecting the patient sample. Once opened, the test cassette should be used within 1 hour. Step 1 is collecting the tear sample. If the patient has used anesthetic or topical drops, you must wait 2 hours before collecting a tear sample. Perform the InflammaDry test prior to instilling ocular anesthetic, topical dyes, or performing Schirmer testing. Locate the sampling fleece on the underside of the sample collector. Instruct the patient to look up and gently lower the eyelid to expose the palpebral conjunctiva. To collect the tear sample, dab the sampling fleece in multiple locations along the conjunctiva, releasing the lid after every 2 to 3 dabs to allow the patient to blink. After completing a minimum of 6 to 8 dabs along the conjunctiva, allow the sampling fleece to rest on the conjunctiva an additional 5 seconds to ensure saturation. Visually inspect the sampling fleece. When a sufficient tear sample is collected, the fleece will glisten. The fleece may also turn patchy pink in color, depending on the patient's tear composition. If the fleece is not glistening, repeat the tear sample collection process. Step 2 is assembling the test. Locate the test cassette and remove the protective cap from the test. Assemble the test by gently placing the sampling fleece into the sample transfer window of the test cassette. Press firmly where indicated until the test feels secure. Step 3 is running the test. Immerse the absorbent tip into the buffer vial for a minimum of 20 seconds, or until a purple fluid wave is observed moving across the result window. Remove the absorbent tip from the buffer vial, replace the protective cap, and lay the test flat on a horizontal surface for 10 minutes. After 10 minutes have elapsed, the test results may be read. The results of the test are indicated through 2 lines, which appear in the result window: the control line and the result line. The control line appears as a blue line in the control zone and must appear for the test to be valid. The presence of only a blue line in the result window indicates a negative result. If the test is negative after 10 minutes, allow an additional 5 to 10 minutes of running time prior to interpretation. The presence of both a blue line in the control zone and a red line in the result zone indicates a positive result. Any form of a red line, whether faint, broken, or shadow, is indicative of a positive test result. A positive result indicates the presence of matrix metalloproteinase 9 in tear fluid is greater than or equal to 40 nanograms per milliliter. Commit to making the right diagnosis with InflammaDry, an easy-to-use disposable in-office test that gives accurate results in just 10 minutes. For more information about InflammaDry, visit www.inflammadry.com.